Okay, I think we can go ahead and get started.
Great.
Dr. Schubert, if you want to tell us a little bit about yourself and then get started with the webinar.
Yeah, absolutely. Well, thank you all for joining me this evening. I'm Jen Schubert. I work as a hospitalist. I've been practicing for 12 years in the Cedar Rapids area, and also recently started taking some work as a physician advisor. I appreciate you all taking the time out to join me to discuss this very important topic. Bear with me, I've never done a webinar before, so I'm a little bit nervous and my technology skills aren't wonderful. So please tell me if you have any issues seeing my screen or hearing me or anything else. I also want to caveat today's presentation with, I believe it's a very, very important topic. And I do have growing expertise in this area, but I'm by no means the expert. And also it's a growing body of evidence that's ever changing. So, I believe we all have an obligation to educate ourselves and each other on this topic. So if anybody has additional comments or experience or anything else that they would like to contribute, please chime in. And there'll be additional time at the end for anybody who has questions or additional thoughts. So with that, I'd like to go ahead and get started with a story. So it was August 10th, 2020, the derecho. Um, I don't know if anybody else was working that day, but I was working inpatient in Cedar Rapids, and it was very hot and very humid. We were still wearing our COVID-19 PPE because we were in the middle of a surge. And when that storm moved through, we had very little warning. Our hospital lost most of our power, including its air conditioning, and most of our communications. We had no paging, no phones, no texting, and no access to Epic. We also had an ED in a hospital that was already full of patients at the time. And after that storm moved through, we had more that arrived that needed care and support because the rest of the city was also without power in that heat. We quickly learned that we had plans for any one of these scenarios, but we didn't have a great plan for all of the above. And for me, this was an eye-opening experience for disaster preparedness, as well as the risks severe weather poses to healthcare, even here in the Midwest. As an aside, we've had 6 derecho level storms since that one to hit Iowa. Compare that to the 10 events that occurred in the 40 years preceding that one. So I'm sure many of you were affected by this recent IV fluid shortage, as well as that one in 2017. And I'm also positive that most of us care for patients with at least one of these conditions on their problem list. But what is it that these all have in common? Well, it's that they're all made worse by the changing climate, and none of us or our patients are immune. So literally from conception to grave, we are all impacted by the increasing risk of extreme weather events, heat-related illnesses, fossil fuel-caused air pollution, changes in our food and water systems, increasing zoonotic and vector-borne infections, and harms to our mental and psychosocial well-being. These risks also disproportionately affect populations that are already vulnerable to other impacts to their health. Our infrastructure is also at increased risk of damage due to extreme weather events driven by changing climate, and our system is at risk due to increased demands. So the evidence is more clear than ever. It is harming our patients. Ambient air pollution is now the leading environmental risk factor for illness and death worldwide. In fact, per most recent analyses, approximately 1 in 5 deaths could be attributed to fossil fuel-related air pollution, and air pollution has been linked to all of these conditions. Globally, all-cause excess death due to fine particulate and ozone air pollution is estimated at 8.3 million deaths per year. 42% of this mortality burden is related to cardiometabolic conditions, particularly ischemic heart disease, followed by stroke and COPD. And this doesn't even consider the impacts to our health related to things like microplastics and other chemicals of concern such as PFAS and PVC that are also derived from fossil fuels. Furthermore, populations at the greatest risk from these environmental harms are also the same populations at increased risk due to other socioeconomic burdens to their health and for similar systemic reasons. The 2025 State of the Air report that's produced by the American Lung Association found that even after decades of successful efforts to reduce sources of air pollution, still 46% of Americans, that's 156 million people, are living in places that get failing grades for unhealthy levels of ozone or particulate pollution. Sadly, this is 25 million more people breathing unhealthy air compared to last year and more than the last 10 years. Unfortunately, this includes many Iowans. As you can see, much of the state is not even reporting the data, but those that are overall getting failing grades. And our infrastructure is at increasing risk. From 1980 to 2024, there were 403 confirmed weather disaster events, with losses exceeding $1 billion in the US alone. This included droughts, flooding, freeze, severe storms, tropical storms, cyclones, wildfires, and winter storms. There was at least 17,000 deaths attributed to these and significant additional economic impacts. If you look at the graph, you can probably see, but from 1980 to 2024, these events averaged 9 events per year, but the frequency is increasing. In the last 5 years, from 2020 to 2024, the average was 23 events per year. Also, as of January of this year, this data comes out of NOAA, and they're no longer updating this. But as the recent flooding events in Texas and New Mexico show, these disasters are obviously still occurring. And you may also notice that the deadliest weather-related hazards, extreme heat, is not even included in this data. As an example, just last month, 100 million people across the US experienced record heat. Roads buckled in 4 states, including here in Iowa. Deaths are reported in several states, and multiple hospitals, including those in Chicago and New York City, had trouble maintaining their power and their air conditioning. And we are part of the problem. The healthcare sector has a significant climate impact, responsible for 4.4% of all global greenhouse gas emissions. If the healthcare sector were a country, we would be the 5th largest emitter in the world. And the US has the largest climate impact of all healthcare sectors worldwide. We're also responsible for 8.5% of the total US emissions. The good news is we have perfect real-world examples to support that there's near immediate benefits to health with improved air quality, with the COVID-related restrictions that reduced on-road transportation, which showed in a recent study that an estimated 9,300 deaths from air pollution were avoided due to pandemic-related lockdowns in the US. In China, this result was even more impressive. Coronavirus shutdowns likely saved between 53,000 and 77,000 lives, which was many times more than those affected by the direct toll of the virus itself. Also out of China, measures to clean up the air in and around Beijing for the 2008 Olympics led to a temporary 8% drop in overall death rate. And as you can see by all of these groups that have joined the Medical Society Consortium on Climate and Health, there is building consensus in the medical community that we need to become part of the solution. So hopefully I've done a good job of convincing you the importance of planetary health to the care and well-being of our patients and our communities. So hopefully you're now asking yourself, what do we do about it? So clinical care is the primary driver of healthcare greenhouse gas emissions and pollution. Nearly every click in the EMR has an environmental impact. It's our collective choices, from prescribing to device use to selection of anesthetic agent to surgical approach and preference cards to waste disposal, along with minimizing low-value procedures, follow-ups, tests, and interventions that can help reduce healthcare's negative impact on the planet. As a starting point, Here is the recently published 8 recommendations for providing high-value, low-carbon care that was produced by Choosing Wisely Canada. These recommendations include using disposable gloves only when hand hygiene is insufficient, intentional prescribing and deprescribing practices, leaning on virtual care where appropriate, avoiding tests that will not lead to change in management, and discussing goals of care and health trajectories with your patients before ordering any testing or interventions. We can also provide guidance to our patients on the co-benefits of making certain choices, both to the health and to the planet. As noted earlier, air quality has a strong association with health outcomes. Patients, especially those at risk of respiratory disease and have other high-risk conditions, or especially those with respiratory disease and other high-risk conditions, should receive anticipatory guidance on the sources of indoor pollution and how to monitor outdoor air quality levels and take action when necessary. I'm not going to read this to you word for word, but it's a great resource also put out by the American Lung Association that essentially says, know your local air quality forecasts, avoid being outside as possible when the air quality levels are poor, especially if you are at risk, and take measures to reduce your own impact on air pollution, mitigate indoor air quality concerns, and support local, state, and national efforts to reduce air pollution. Also, as noted, extreme heat-related deaths are the highest of all weather-related mortalities. Groups at most risk for heat-related injury or death include children, elderly, people experiencing homelessness, people with pre-existing conditions, people with disabilities, outdoor workers, workers without adequate air conditioning or ventilation or limited access to water, emergency responders, incarcerated people, low-income communities, pregnant people, and athletes. Our patients should be educated on these risks, as well as the signs of heat-related illness and methods of prevention, which include things like increasing hydration, medication adjustments if appropriate, avoiding direct sun exposure, and wearing loose-fitting, light-colored clothing when heat levels are high. And this next one might be blasphemy to say in Iowa, but meat consumption is contributing to greenhouse gas emissions and requires high land and high water use to support. We also know that evidence suggests that diets high in red meat are associated with elevated LDL levels, increased risk of certain health conditions such as cancers, obesity, diabetes, and premature death. So therefore, counseling on a nutrient-dense diet containing minimally processed foods that is plant-forward and minimizes added sugars, sourced locally ideally when possible, is good advice for our health as well as for our planet. For anybody interested, this QR code has a 10-minute online course regarding sustainable diets and how to educate patients. Another great opportunity for co-benefit counseling is regarding the Safer Choice labels put out by the EPA. These products all earn this designation for containing ingredients that are safer for human health and for the environment. Most products that have received this designation included on their labels, so they're easy to find. These next few slides are just some great resources for anybody that's interested in digging deeper. This one is Climate RX. It's a resource that helps health professionals educate patients on the impacts of climate on their own health, as well as ways of protecting their health in the changing climate and ways to get more involved. You can sign up to be one of their participants. They send you a QR code that you can post along your office or keep on your badge. It includes both patient-facing and healthcare professional sites in order to access tools and training, peer-reviewed information, and opportunities to take action. Another great resource for anybody wanting to dig deeper on this, this is My Green Doctor. It contains ideas for your office, your family, your patients, and your community, and is presented in a step-by-step approach that uses 5 minutes in each of your regular scheduled office or staff meetings. And it requires no preparation or study beforehand. It literally lays out everything suggested, and you can choose which to use and which not. Most of these suggestions are also money saving and resource saving. Another quick resource, some of you may have seen this already, but Vote Plus ER is a resource that assists patients and staff members in registering and maintaining voter registration. Again, with a QR code that can be posted and shared, and a possible badge QR code if you choose to carry that. My last resource that I'd like to share tonight is the Medical Society Consortium of Climate and Health, which represents over 1 million physicians and healthcare professionals. The site is great. It's got podcasts, presentations, and toolkits, a lot of other great resources, handouts, pretty much anything in the realm of climate and health, they have a resource for. And they also host a really wonderful annual conference for scientists and health professionals that work in this space. So in summary of what we can do as individual clinicians, recommend that we use mindful prescribing practices that avoid overprescribing and deprescribe whenever possible. Improve care coordination, which reduces commutes, reduces no-shows, and shown to improve compliance. We should understand the basics and talk to our patients about environmental impacts on health and healthcare's impacts on the environment. We should know our referral resources for our patients that are at risk of climate-related health impacts, such as energy assistance programs and food assistance programs. I've included links here for our Iowa resources. And we should take the opportunity to identify waste reduction and recycling in our own spheres of influence, as well as advocate for policies that support reduction in greenhouse gases, eliminate chemicals of concern, and protect access to clean water, clean air, and green spaces. Lastly, I recommend those that can to vote and encourage your patients to do the same. So we talked about the co-benefits of certain choices to our individual patients, as well as the planet, but that's only part of our equation here. As noted earlier, the healthcare sector is responsible for nearly 9% of America's greenhouse gas emissions. Thankfully, there are also co-benefits to our health system as well. As you probably noticed in the previous section, a lot of the recommendations also are around avoiding low quality care, which is important to a healthcare system as well. Other ways of addressing climate as a healthcare system is very complex, like most things in a healthcare system. But many solutions in decarbonization and electrification are also money saving, cut waste, build organizational and structural resilience, and reduce low value care, which is important now more than ever. There are new funding, knowledge supports, and expertise emerging every day, and many healthcare systems have already found success in this work, which hopefully we can replicate. Midwest examples include Gundersen Health, which reached net zero in 2014, and Advocate, which is on course to meet 100% renewable energies by 2030 and has already pledged to be net zero in the Scope 1 and Scope 2 emissions by 2050. So I encourage healthcare systems to acknowledge that there's an interconnection between climate and health on our patients and our communities, like we're doing here today. Apply a climate impact and mitigation lens into decision-making, both at the clinical and the organizational level. Ideally, designate leadership to drive change at all levels. Calculate emission data and compare to benchmarks, and ultimately set goals to be at net zero. And at a minimum, develop climate resilience plans and disaster plans that include more extreme scenarios, such as the derecho in Cedar Rapids in 2020, and also anticipate that these are going to occur more frequently. Finally, we should all join others in their public commitments to these goals. So I'll wrap up with this. Climate change affects the health of our patients and our communities, as well as our infrastructure and healthcare system as a whole. We need to have preparedness plans that acknowledge these new realities. We need to acknowledge that we contribute to the problem and therefore should integrate climate action into our strategy. And the benefits to health are nearly immediate, and the time to act is now. So with that, be happy to take questions or open for discussion if anybody has further thoughts. I do have some additional resources which I can send out for anybody that wants more information or details on where this came from. But yeah, if nobody else has anything else at the moment, happy to end it here.
Perfect. And I took a recording of this webinar, so I will put it up on our iowaacp.org website for
Great.
anybody that might want to scan some of those QR codes, and those were some great resources. So thank you.
Yeah. Thank you all for your time tonight. Also, that's my email if anybody wants to reach out. Happy to take individual questions and provide additional resources.